So pleased that you could join us today for the first of Wharton's CCI webinars for 2024. Before we go any further, though, I would like to invite one of our panel speakers today, Auntie Kerry Doyle, to do our acknowledgement of country. Thanks, Auntie Kerry.
Thank you very much for that. You know that Indigenous people always had an acknowledgement or welcome of country to country. Most people recognise the smoking ceremony as one, but women also in many areas of Australia, and certainly in my mother's country, had a welcoming ceremony that included water. So just to say that there are differences in what we do. The other thing really that I think we should consider in acknowledging country is acknowledging the loss of some of our wonderful elders, our wonderful aunties, and including with respect Lewitcha O'Donoghue, another one of the founding members of Katsanam, and one of the aunties, or a few of the aunties from Wagga and Bathurst and around. We've had a huge loss in the last couple of weeks for our aunties, and they're the holders of our wisdom. So remembering, acknowledging country means acknowledging the people of the country too. But let me welcome you all to the seminar on the behalf of everybody from the country. Thank you.
Thank you so much, Auntie Kerry. And thank you for those, remembering those who have passed. It's so important. I'm pleased to have Jo Ong, Ashley, Ing, and Auntie Kerry with us today. Jo and Ashley are going to be presenting on their reflections and their expertise on CCI. And then when we get to our Q&A section, I'll invite Jo and Ashley and Auntie Kerry back to sit on a panel so you can ask them as many questions as you like. And the other thing too is if you actually think of a question during the session and you don't want to forget it, you can pop it in the Q&A box and we'll capture it during the panel discussion. So before I introduce our first speaker, I'd like to reflect on the rationale behind today's webinar. So last year, following our 3 webinars that we presented on CCI, we asked a question, we put a question out to you and we said, what else would you like to know about CCLI, so excuse me. After receiving your comments and questions, we compiled them and started categorizing them into some common themes, and 2 of which we're going to be looking at today. So the first category contained questions about CCI before a research project begins. So in other words, things like, how do you recruit consumers? How do you find consumers to contribute to project planning in a specific research area? For instance, building authentic relationships, and why is that important? And should you advertise for engaging and involving consumers? And then the second category pertained to questions around CCI after your project begins. So things like, do you need formal agreements in place for consumers? If so, what does that look like? Amy, we can go to the next slide there. What level and type of reimbursement for consumers are standard? What's practically achieved? When and how is reimbursement provided, perhaps? Or how to deal and navigate the influence of varying power structures between different stakeholders. So that's what we compile. We listen to your answers to the question that we asked. And so we have 2 terrific speakers on the subject matter that you asked about, and that's Jo and Ashley. But I'd like to actually introduce Jo first, who is CCI Project Manager at Monash Partners. Jo has done and continues to do a lot of work around consumer engagement and recruitment. And she's going to share with you this afternoon some practical tips on recruiting, engaging, and involving consumers in your research projects. So I welcome you, Jo.
Hi, everyone, and thanks to the Women's Health Translation Network for having me come and speak today. Before I begin, I'd like to acknowledge and pay my respect to the traditional owners of the Wurundjeri peoples and the clans of the Kulin Nation where I'm coming from today. So I'm going to talk to you about steps to successful consumer and community recruitment and authentic engagement. And I'll be drawing on some of the research that I've undertaken, as well as my work recruiting to consumer advisory panels and consumer and community networks for healthcare improvement. So to begin with, recruitment. Plan out the details. Really, this is the most important thing before you start a project and before you start recruiting. So what is the purpose for involving and engaging consumers in the community? Why would someone from the community want to get involved in your research? As a researcher, you know what you want, you know what it is, you know what you're trying to achieve, but what does that look like from a consumer and community perspective? The literature suggests that people put their hand up to help because they want to make a difference. They want to make a difference to diagnosis, to treatment, to service delivery, and to other people. They want to be heard, they want to be recognised as a voice of their community. And participation can create a social network of supportive peers. Hearing other people's stories can be therapeutic and help people to share their own experiences. So my challenge to you is, if you had 1 minute to convince someone to participate in your research or your healthcare improvement work, what would be your elevator pitch? Next slide, please. So still in the planning phase, what is the purpose for engagement? So consider the IAP2, or the International Association for Public Participation. This is their spectrum of participation. Where does your consumer and community engagement and involvement sit on this spectrum? Are you seeking, go forward one. Are you seeking their feedback on work? So are you consulting? Will you work with people to design a program or project? So are you involving them? Or will consumers lead your projects? So right at the very most powerful end, the empowerment section. And then in addition to this, what is your promise or your commitment to the consumers you're working with? Knowing your purpose will help you to put together plans for how you engage and involve consumers. Next slide, please. Projects and programs will have varying levels of consumer and community participation at different stages of their development. The National Mental Health Commission have put out this really useful guide on consumer engagement, and it can help you work out how you will involve consumers and what stages will you involve your consumers. Are you testing out a new idea? Are you delivering a program? This matrix of engagement and participation offers practical insights on different ways to involve and engage consumers. And my little tip here is, if you're establishing an advisory group, or a steering group, have at least 2 consumers on that group so they can lean on each other, and because it can be particularly daunting when you're in a group with academics and clinicians and health professionals. Next slide, please. In what ways will you involve consumers in your research? Is it a survey? Is it a focus group? Will they be members of an advisory panel? This levels of patient and research engagement by Manifo offers suggestions on different ways as a researcher you can engage and involve consumers based on the IAP2 spectrum of participation. And I believe that a lot of these links will be shared in the chat as I go through. And another little tip here I put in here, mix up your engagement. So if you've got a 12-month project, mix up how you engage your consumers. Do a survey, do focus groups, do workshops, mix it up so you can keep your consumers engaged. Next slide, please. So now you've got your why, your what, your how. There are also some other practical considerations. So who do you want to recruit? Consider gender, age, cultural identity, health service attendance, lived experience of illness. What are your requirements for participation? And do you need consumers who have particular skills or experience? Consider how long is the engagement? Is it a short-term engagement? Is it a one-off? Is it a long-term? What are the commitments? What is the commitment for the consumer? Will you be meeting online, or will you be meeting in person? Another challenge to you over 12 months, how will you continue to keep your consumers that you engage with engaged so that they continue to engage rather than dropping off as you go along. And also, will you pay consumers for their time? And do you have money to pay them? There are a lot of freely available resources that can help you work out these things. Put a couple of images from some resources which I found quite useful. So the Australian Clinical Trials Alliance have a toolkit for people conducting patient-centred clinical trials. The West Australian Health Translation Network have a practical how-to guide for researchers, consumers and funders. And of course, Monash Partners has seminars, self-paced modules and practical resources such as this reimbursement guideline that is freely available on our website. Next slide, please. So now you've got the why, what and how. The next step is to bring it all together. Write your recruitment information in plain language. Communication in plain language is wording, structure and design that readers can easily find what they need, understand what they find and use the information. Develop resources for different communication and promotional approaches, websites, social media, flyers, everything. And then the information that you need to be putting in your recruitment materials should state very clearly your purpose, who you're trying to engage, what are the benefits of engaging, and what's the commitment for people who do engage. You know, is it 3 times over a year? Is it a one-off thing? Is it a survey? And then finally have a call to action. So where can people sign up, or where can they find out more information? And what I like to do on our posters is put a QR code, so you can, and this, by the way, this QR code goes to our Child Health Consumer Advisory Panel if you're interested. This goes directly to our EOI and then people can fill that out. Another thing I would suggest is get some tips on how to write in plain language, or use an online readability checker to see what your EOI or what your terms of reference, where does it sit in terms of readability. And of course, if you can, develop your resources with consumers. Next slide, please. Okay, so finally we've done all the planning. Now, recruit widely. Just go through your networks, your informal networks, your formal networks, put it out there that you need people. Tap into local councils to connect with underserved populations. And I believe there is a Women's Health Translation Network recorded webinar that can help you get some tips on how to do that. Contact peak bodies and not-for-profit organisations. Share your website, your flyers, your posters, and do presentations. And in fact, yesterday I went to a local council and I did a presentation. And I leave flyers at places. I visit not-for-profit organisations and outreach groups. Go far, go wide. Do what you can to get your message out there. So next, I'm going to talk about authentic engagement, but not for very long because Ash will also touch on this. How do we involve consumers and the community in an authentic and meaningful way, and if at all possible, avoiding tokenism? Next slide, please. So be intentional about creating a high-functioning, diverse and engaged group of consumers. Using all the information that you've done in the planning, assess your need and recruit thoughtfully. Set clear expectations on the purpose, the scope of your work and the responsibilities for your consumer and community members. Offer different ways to communicate and connect. Some people just like text messaging and others like to chat, like pick up the phone and chat to them. And be bold. Involve people from different backgrounds and diverse perspectives. Embrace diversity and difference. And I cannot understate this, you will truly be rewarded by doing that. Next slide, please. Take the time to build relationships. And this is a quote from one of the qualitative interviews we did last year. Build a relationship and know them beyond a professional level, because they're not employees. It's more of a social relationship, isn't it? So get to know your consumer and community members. Have a go-to person, and that could be you, and encourage all the members of your community network to share their views and really value and promote the lived experience and perspective. And a tip that was given to me that I've used quite often is that we try and meet in person at least once. It's a really grounding experience where you can meet in person and share your experiences. Next slide, please. Identify opportunities to connect and build. So continually seek feedback from your consumers. This can be done informally through just a conversation or anonymously through a formal evaluation. Communication feedbacks are critical and they're critical for continued and sustained engagement. Understand your consumer interests and their priorities, and then knowing those interests and priorities, offer different types of activities to keep them engaged. And then finally, provide opportunities for them to build their skills and expertise. And in fact, next week we'll be having some of our consumers co-chair one of our meetings, one of our research meetings. So that'll be an opportunity for them to build their skills. Next slide. So that's pretty much the end of my presentation. In summary, for recruitment, plan out the details, put your information together in plain language and recruit widely through your networks. Around authentic engagement, be intentional about creating a high-functioning, diverse and engaged group, and take the time to build and maintain those relationships. And finally, identify opportunities to connect and build capacity in your consumer and community networks. Thank you very much. That's it from me, and I'll pass on to Ashley.
Thanks so much, Jo. That was absolutely fantastic. And I have to say there's a plethora of links available in the chat box for people to have a look at. They're terrific resources, and your overview of everything was just brilliant. So thanks so much, Jo. I'd like to invite Ashley now, who's the Project Manager and Research Fellow at Monash Partners as well. And Ashley will be presenting some practical tips on CCI after the project is set up. So thanks so much, Ashley.
Great. Thanks, Leslie. And thank you so much for inviting me to have a chat to you guys about this. Thanks, Jo, for such a great overview to set everything up. So I'm Ashley. I'm the Project Manager for the Consumer and Community Involvement Implementation Research for Impact project, which is an MRFF-funded program to help essentially develop a digital knowledge hub to support consumer and community involvement. And through that piece of work, I've been doing lots of interviews with different stakeholders, as well as a scoping review with Jo. Jo's been doing the scoping review, not me, and as well as a survey that I'll talk about a little bit later on too. So I thought, now that Jo has set up, how do we find people? How do we get them engaged? What are the key tips for there? Once you've got these people, what do we do? It's not as crude as what do we do with these people, but how do we build relationships? How do we keep them engaged and keep them involved and get the most out of this relationship for them, but also for you in terms of your research? And so that's the first thing I wanted to talk to, is setting expectations. Jo mentioned around setting up a terms of reference. So you can have a terms of reference or an involvement agreement with your group. And this is really great co-design piece of work as well. So you can have a template there that you think would work, and then send it back to your group of consumers and say, what do you guys think about this? Do you think this accurately reflects the working relationship we're going to have? And as part of that, having a shared purpose that you guys establish around what is the purpose of bringing everyone together in this group. And that's a really nice fallback piece of paperwork you can go back to when things may go a little bit out of hand, or the group starts to sort of diverge a little bit from their original purpose. So you can always say, hey guys, remember we brought everyone together here for this shared purpose and this reason, and it's written here and you've agreed to it. So you've got that piece of writing there as well. Not yet. When you are establishing those, documents, really ensuring that you have everything written in plain language, as Jo said, the worst thing you can do is have something there that people then have to Google every second word because they don't understand what it means. So with these terms of reference, really important to then review them regularly, either on an annual or every 2 years, if your thing is ongoing. And so also consider that with the nature of having consumers in these different groups, depending on what type of project it is, people might drop in and out, depending on people's life stages and stuff. So you will need to reconsider the group that you have, what gaps you have currently, and how you can fill these gaps. And then with that, changing up the terms of reference as needed as well. And so next, we'll be talking about understanding the consumer journey. So it's really like any retail experience. You have to understand what is happening in the back end for you as a researcher, going through all the different steps and processes, what that looks like, but also how that translates at the front end. So walking in their shoes, and that could be from a very physical experience. So if you're having an in-person event, when a person arrives at the doorstep, what do they see? Where are they going to go? How are they likely to walk through to get to your event and experience that? But also as from if you're doing, say, online focus groups and things, what does that look like? Envision how that reimbursement process happens as well. What happens to the back end? What do they see? So that if along the journey, any step of the way, if something happens, you are able to then troubleshoot and say, okay, well, they should have received this, but they haven't. So that's where the problem is. So you can then go and sort of sort that out from there. And so that is really important, because if you think back to customer satisfaction, if your experience of purchasing something or going to an event, if that's not a pleasant experience, you're not likely to come back. And so you want to think of it in the same way when working with your consumers and the patient groups as well. So the happier they are, the more satisfied they feel valued, they feel important. And so they're more likely to be more comfortable in sharing their experiences as well. And then the next thing that goes hand in hand with that is supporting them. So not just the consumers, but also the researchers. So be thinking about any accommodations they might need. For example, if you're having an in-person event, are there any accessibility things you need to be thinking of? Same with online as well. Do they need support in setting up Zoom, in internet connectivity, in setting up, your camera or things like that? Having a bit of a run through, having someone to support them before the actual event, before the actual meeting, whether that is, understanding the papers that you send out, the brief, the actual project itself. The number of times I've heard through interviews that people have spent almost a week just deciphering a simple agenda because of the number of acronyms that are included in there. They didn't know what all those things meant, and they didn't want to look stupid, so they started Googling them and trying to understand all of it. Your consumers do spend a lot of time trying to understand and present themselves well. And any steps that you can do to help make that easier, that process easier, would mean a lot to them. So making sure that you are upfront about things that you can and can't accommodate. So for example, and that's the same with reimbursement as well. You can be very upfront and say, look, we don't, as much as we would love to, and we understand the importance of it, we can't financially support you, but here are the things that we can do instead. Down the track, when we have grants, we'll make sure to include a budget line item, and would love to have you involved if you're keen, and work through that. So having very open conversations there. They acknowledge that, this is a very new field for a lot of people. And so you being open and being human to them on that level helps to alleviate some of that stress and worry that they have. So that helps them to build that safe environment as well. And another key thing with that is the role of the facilitator is really, really important. And that comes down to addressing power dynamics and making sure that people have the confidence and the space to speak up. So ensuring, that's where you can maybe drop titles, for example. People feel a little bit intimidated if they know there's a professor in the room versus, they're just another Joe Blogs off the street. They just want to chat and find out what you're trying to do. And trying to find out how they can help there. So that's really important in facilitating that as well. And there's lots of different training that's available for facilitation, of course, of groups and meetings. So while it's all well and good to sort of say, we need to be training consumers to sort of support us and things in our projects, the same might be needed for the other end. So there might be training needed for researchers and clinicians. And these could be simple things like, what's the type of language that we need to be using when addressing this group, when this community group? And so setting those different things, like very simple, okay, what are some questions that we can ask, and how do you best ask that? Having a bit of that background can be really helpful as well. Okay, so next up, we're talking about building and maintaining relationships. And this is where Joe mentioned before, having those strong foundations are really important, and it's beyond that professional relationship. People want to get to know each other on more of a social level. And that's where through those relationships, you get those really nice, deep, meaningful conversations as well. And so if you are having a steering group, for example, and you have a consumer spot, making sure that there's not just one, if possible, having two people there so that they can buddy up and say, you're also another consumer. Can we hang out for a little bit, or can we get to know each other? And you can also think of it as a job share opportunity, because with consumers, they're often asked to volunteer their time for so many different things that it's unlikely they are able to meet every single meeting or be available every single time you need them to. So being very mindful of their time. And so if you think of it as a job share opportunity, if someone isn't available, at least you have someone else there as well, and keeping them both in the loop. So that communication piece is super, super important. And for consumer groups, so if you have a group just full of consumers, it's really important to give them a bit of space to connect with each other, because the more that they understand and know who that person is and what they bring to the table, they're more likely to be during conversation say, Mary had that experience one time, maybe you should ask her about this and that. And that person may not even be thinking about it at the time, but they go, oh yeah, I did mention that, and this is my experience. So I think that's always helpful to help facilitate meaningful conversation. And this is also through my own experiences as an advocate, where we were brought into this whole room. Just because you bring a room full of people with lived experience together doesn't make it a community as such. You need to help facilitate that slowly and help them foster the environment to then build those relationships, which then they can then use and bounce off, and will come in really helpful down the track as well. And so with all of that, in summary, I think really have a think, come back down to the why. Why are you doing this? Why is it important beyond just getting grants and getting that tick box? Why is it important to engage consumers? They are the people that will be using this health service or this outcome at the very end. What you're working on, this will impact them. It has a massive ripple effect. If you've got really engaged consumers involved, they are likely to share the word with their networks, with their community members. And so you might see an increase in participation rates across the research, but also uptake down the very end when you're implementing stuff. And so I'll leave you with that question of how are you influencing change across the community? And at the very start, I mentioned that I'm working on this massive project around developing a digital knowledge hub. And so part of that, we've developed a national survey to understand people's perceptions, experiences, and thoughts around consumer and community involvement. So one of the WHRTN team will share a link with there, and I really hope that you take a chance to complete the survey, but also share it broadly within your networks, because we want to hear what different stakeholders need to help them with their consumer and community involvement journey. Thank you.
Thanks so much, Ashley. That was just fantastic. I'm really pleased that you mentioned a shared purpose as something that's really, really important right from the very beginning. And that everybody, because it's shared, has had a hand in actually coming up with that purpose, so that you can always fall back on it when things get a bit hairy. And the other thing that I loved what you were talking about is, the amount of consumers that you have on committees and or working groups, on your research teams. I remember somebody saying to me once, because we often just rely on one voice, one lone voice there. And this person said to me, one consumer is vulnerable, and 2 are supportive, and 3 are empowered. So I always look to see if it is possible to have 3 consumers, because it brings not only diversity, but amazing support and empowerment to speak and come forward and speak their voice. So this is the time now that we bring together Auntie Carrie, Ashley, and Joe on a panel to see if we've got some questions from the floor. And if not, I do have some up my sleeve too, because I'm really interested. And I've just gone in, I'm just going into the Q&A box. I don't have any questions in the Q&A box as yet, but please, while you're having a think, I'd love you to put some in there. But I'd actually like to ask a few questions of the panel. And I'll start with you, Ashley. Can you expand on why that shared purpose and perhaps even a set of guiding principles is so important? It would be great to reiterate that.
Yeah, I think establishing a shared purpose, and you made a really good point about having that co-design with the consumers, because they then understand what the project is about. They understand why they're there in terms of what expectations and how they can contribute. But it gives them a sense of purpose. And I think having that established at the very start, together with the researchers, they then also understand how they can then work with the consumers around getting what they need, but also helping consumers get what they need from it. So it's setting that expectation from the very start that this is what we're here for. And it really empowers and sort of reinvigorates both parties, so researchers and consumers, that, oh, you know, we're really excited, we've developed this together, we're excited to get started into it. So it really helps to set the scene.
It's terrific, because it creates that lovely ownership.
Yeah.
Doesn't it? Yeah. Auntie Carrie, I'd like to ask you, do you have some thoughts and advice, perhaps in relation to your own culture, about recruiting for Indigenous research committees and or working groups?
Well, I think one of the important things to remember is that whatever time you have put aside to create your governance groups and your working groups and finding consumers, is you need to double it, because it will generally take that much time. The other thing is all of the ethics committees now require you to have a governance committee with terms of reference, etc. So it's something that you need to consider to be building into your grant applications as well.
Mm-hmm.
And we have a partnership cycle that we use where, you know, there's about 4 different parts to it, and each of those parts has 4 different parts. So you can see it's quite complex. It's complex anyway, but it's more complex in communities because of the difference in communities and the different groups within those communities.
Mm.
And sometimes it can be politically challenging to find the right people on your consumer group. So bottom line is just be brave, have courage, and be kind, as my boss always says.
Oh, goodness sakes. That's a message for the world, Auntie Carrie. I do have a question from the Q&A box. What examples do you have of CCI for translating health research into accessible information for the public? What worked well in the process? I can actually think of one that I was involved in, but I would prefer to acquiesce to my panel. I'll open that question up to all 3 of you. Do you want me to repeat?
I was going to dob you in and talk about the PCOS stuff.
Oh, yeah.
That was such a huge success in terms of how consumer and community involvement played such a big role in determining what the community needed. And so we always talked about, I guess, researchers.
Ashley, can I stop you there for a second? I want you to back up. What's PCOS, and can you give us a brief thing about that research piece, just for people who don't actually know about it?
Gosh, I feel like I'm not going to do it justice. So polycystic ovarian syndrome is a huge condition that affects women around the world. And so the project that, gosh, really put me on the spot here. One of the main outcomes was the development of an app, so the Ask PCOS app. And so that has resources, stories from women around the world about living with the condition, how they're managing it, as well as I think there is like a discussion forum type function. I'm not 100%.
That's right.
But that's a tool that has been developed with consumers from the very start. So often researchers tend to come in to a project with ideas around what could potentially work. So with this one, I think the key thing was they flipped it and went to the community and said, okay, what is the problem here? And from there, while identifying what the problem is, start to work towards a solution. Did you want to expand on that?
No, I was just going to say you did a great job, Ashley. Well done. I was just going to say this was an international collaboration to the point whereby this app is now available across many different countries, enabling and allowing information to be accessible to the public. And this is because one of the things that Ashley touched on was the stories that are embedded with that. It's the narrative that actually supports it and makes it so effective. So I think in answer to that question, what worked well in the process was the engagement, as you said, Ashley, of consumers and the community right from the very beginning. Yeah, it was a brilliant undertaking, a massive undertaking, in fact, and a project that has touched the lives and helped many because of the creation of that app and the engagement of the community. I have another question here. Are there any tools available to measure and identify CCI impact? This is a really, really good question. And I will preface it by saying that this type of information is emerging right now. And I'm actually right smack in the middle of a literature right now of finding the impact of CCI, because originally when the idea was put forward that consumers be involved at every levels of service delivery, including planning, research, and the planning of services and that type of thing, it was actually because the outcomes were so good with shared decision making at the interface of care. And so we've broadened it out and extrapolated that to say that consumer voice actually does make a difference. But I can say that something like the PCOS example would actually show enormous impact to women across the world. I'll just see if I can try and get, if anybody's interested, to try and get a link to that piece of research, because it was absolutely brilliant.
I just popped in a link to the our handbook that it was a report that looked at reviewing measuring impact, and so it's quite useful. It's got 4 different CCI tools in it, and there's been an assessment done on when those tools would be useful to use, and in what situation as well. And I'd also go to I'd also have a look at ACTA as well. They've got some great tools on there, resources on there around measuring.
Thanks for that, Jo. Most helpful. That's terrific. Jo, actually, I'm going to ask you a question now. Now you're working with Monash Partners and also in a primary health network. And I just wanted to know, do you think there's any differences in recruiting consumers in those 2 different areas, in research as opposed to in the primary care network?
I think there's quite a lot of differences. In health service and health service delivery and not-for-profits, it's engaging with consumers and community have been established for quite some time, and there are established processes and policies and embedded systems. And I think that we can take, in research, we can take a lot from what's already been established. And we can take all the good bits that we like, but also we can, really acknowledge that there's still a lot of challenges in this space around kind of tick box tokenism, and how do we better engage with consumers. And I think the great thing about research is that we've got the opportunity to do co-design with consumers, and this is co-designing activities to really make a difference. I think that's where we can, that's where the difference is. And also, stepping up in terms of participation. So not just the informing and the consulting, but really the whole collaborating and empowering aspect of the spectrum of participation. So that's, I think that would be my main difference. I think it's exciting. CCI and research is an exciting area to be working in, because you have much more flexibility to do much more work.
Mm-hmm. Jo, what's the most enjoyable thing about working in consumer recruitment?
Oh, it's working with consumers, Leslie. Leslie and I work together. Yeah, amazing.
I'll pay you later, Jo. I'll pay you later.
Okay.
That wasn't what I was assuming you'd answer.
I'm so energized with working with consumers and challenged by Leslie mostly. But no, I love the people, and really working with different communities and getting different perspectives. It's quite humbling, actually, because you realize that there are people out there who just do so much for the community, and they're the people in the world who are making the difference.
Absolutely. We learn from them so much every day, don't we, Jo?
Yes.
Auntie Carrie, I'm going to bring your voice into this. I just wanted to know if there's any that you know of cultural sensitivities that you might be aware of, where recruitment approaches would be very different to different cultures, and including your own. Auntie Carrie, is she there?
She's on mute.
Sorry.
Oh, Auntie Carrie, are you on mute?
Yeah, I didn't want to hear. I was singing along and didn't want everybody. I
But
think you have to be careful about the community that you're entering, and you need to have some idea of who can vouch for you in that community. So and what I always say, if you want to do something in health, you go and find one of the Aboriginal health liaison officers in whatever particular field you're interested in. And education has ALOs, etc. And then remember not to just privilege one voice, but to make sure that you've got a broad range of community members. So it is challenging, I know, to work with cultures that might be a little bit different to yours, but it's very rewarding as well, and I would encourage people to have a go.
Absolutely. There's a question here in the Q&A that relates to that. Does anyone have a contact at QAIHC? I'm trying to engage with local ACHOs in far north Queensland to talk co-design on projects in my PhD. I've tried the generic contact info on their website without success. Any collaboration would be greatly appreciated. Auntie Carrie, would you advise any? I think perhaps your comment about your liaison officers, Indigenous liaison officers, is that what you said?
Yeah, because sometimes land councils, etc. I mean, we have somebody on my team sits with our local AMS, and it's one of the largest AMSs in Australia, and they get about 35 requests a week, and so they can't even answer some of them.
Yeah.
They're just too much, and it's very hard also to sell in your project in a manner that looks as though it's appealing, and as people are going, because if people are going to spend a lot of time and energy and other resources on your project, it needs to be something that will benefit the community, and that can be hard to sell into at times.
Absolutely. It is challenging, that's for sure. Ashley, I'm going to ask you a question. How do you manage consumers who are not meeting expectations or who are not actively participating?
How do you manage staff that are not doing that? I mean, it's
we're all people.
Exactly, we're all people. So I think the only difference there is you have to consider that they are volunteering their time most of the time, and they have so they're not a paid staff. But a lot of people tend to take on these roles with the intention of, being professional in that sense. And so it might come down to sort of this, it's the same concept. You might approach them and say, hey, we've noticed you haven't been engaging. Is there anything that we can do for you? What's happening? And so having that conversation one-on-one as a human to human to sort of see what the barriers are there. And then from there, working out to say, maybe this might not, maybe this isn't the right time for you. And then giving them an option to opt out is always good, because often people get pulled into so many different projects that they feel overwhelmed, but they feel embarrassed to put their hand up and say, I've taken on too much, how do I get out of it? So giving them the opportunity to opt out without any judgment and say, look, maybe there might be opportunities down the track, but this may not be working for us. You just approach it as professional as you can, and while keep maintaining the relationship. I mean, that's how I would approach it.
I would also approach it professionally and personally. It's about building relationships, isn't it? Yeah,
absolutely.
Yeah. Thanks, Ashley. I've got another question here. Could panel members provide tips of how they have involved underserved people in co-designed research? I can answer all over that one, but I'm going to acquiesce to the panel. And Joe, do you want to start that one off?
I think Joe's done a really good job she has done so much work in community advisory panels and reaching out to very diverse community groups. I think she's in the best position to answer that one.
Yeah, I do too. It was really terrific. We had some great insights from Deb Langridge, who's from the Western Australia Translation Network, because she comes from a local council background, and she has imparted such a beautiful piece of gold, which is to actually link in with your local communities. And local communities are charged with the responsibility of being linked in with the communities that they serve. And Joe has actually responded to that, I have to say, in spades, going into local community and going into local councils, and that's where she has found some of the voices. Is Joe still with us?
I am. I don't know whether I can answer your questions though. Look, my experience is that you work with people. You do things as a team, and it's not a tell me this. It's not transactional. It's you work collaboratively. That's it's as simple as that. And you don't treat somebody as though it's a transactional. It's a human kindness, just working together, setting boundaries, but also setting expectations and timelines. And really, that's really all I can say to that. And to answer your question, Susie, around medical colleagues, I think you actually gave me some insights once around this. It's hearing from leaders and having culture change pushed from or encouraged from the top, as well as seeing people like yourself doing great work in this area. And so if you've got change coming from the top and change coming from the ground as well, you can only be taken on a ride in this space. And so I do think that there is change in this area, but it's unfortunately not happening as fast as we would all like.
There's one thing I would add to that too. I remember listening to a researcher who did a beautiful piece of co-design research. She presented a symposium I went to, and one of the things that she actually did was she embedded a section of every single meeting that they had together that was a half an hour afterwards that had nothing to do with the project. And it enabled people to actually have a cup of tea and a biscuit and talk about various different things that's going on in their life, which actually enabled the researchers and the consumers to bond. And it's actually about bonding. So she actually made sure that there was an extra half an hour tagged on to the end of every single meeting so that people had the opportunity to do that. I don't know whether that might help Susie, but she said it absolutely was a game changer.
Can I also add the question around how to involve underserved people in co-design research? I think the most difficult thing is first of all, establishing connection. Going back to one of those other questions, how do you establish connection, and then how do you establish trust? So I think you should go through established groups and go through your networks. It's not like, no one likes to be cold called. No one likes to be, hey, can you do this for me because you're Asian? Go through your networks, or go through established groups to make those formal connections.
Yeah. And just at that same symposium, Joe, I'm so glad you said that word trust. I heard the most beautiful quote, and we're actually going to put it up in a poster in one of the centers that I work at. It's called "Move at the Speed of Trust," which I just think is absolutely ideal. When we're talking about trust and building relationships, Auntie Carrie touched on something a little while back, which was about taking time. And this is something that I have been harping on about for a long time, which is when we're asking to build relationships and we're asking to build trust. And when you consider that saying of move at the speed of trust, that means that there might be more time required. And I wondered if I may ask a provocative question, dare I do it, to Ashley and to Joe and to Auntie Carrie. And Auntie Carrie, I'll start with you first. Do you think funding bodies should have a hand in this in some way?
I think funding bodies have the expectation that you are able to understand that. The formula for trust is consistency over time, and trust is you can lose trust at the speed of light. It's that fast to lose it, and often takes that long for the light to get to your place, sort of thing. So I'm not sure that funding bodies need to. I'm sure that there would be. That's a very good question. I couldn't imagine that a lot of them would pick that up and run with it, though. But I'll hand that over to other wisdom.
Perhaps we could plant the seed. Joe, what do you think?
I don't have an answer. I'm sorry, Leslie.
It's all right. You don't have to have an answer. I put you on the spot a little bit with that one. Joe, Ashley?
What was the question again?
It's okay. Do you think funding bodies should have a hand in some way around the requirement of building trust and relationships takes time based on that?
I think if we want funding bodies to acknowledge that, and this is what they have to recognize as well, is that building trust and relationship takes time. Yep. And that's very difficult to do in a very short research grant timeframe. So when you have grants that are 2 years long and you're expected to have genuine and meaningful consumer and community involvement in that time, that's very difficult to do fresh. So what funding bodies would support in that area is by providing seeding funds to help establish those connections at the start. So for one of the projects that I'm working on, we've actually gone to the industry to actually get funds to establish that group. So a consumer advisory committee.
Right.
Is there was no other place to get that seed funding from. So I think if funding bodies can acknowledge that and come to the table with, that sort of model or opportunity to say, yes, we acknowledge that it does take time and effort and funding and resources to build this relationship. Here's a little bit of funding to get you going. Mm-hmm. I think that's a step in the right direction.
That's great. I have a question in the Q&A. How do you overcome the challenge of people not being engaged in your project, and can paying participants assist?
Yes.
So a few questions, I've got a few questions in relation to that. Like, are you seeing the consumers as participants in your research? Like, are they participants in your research, or are they partners working together to help you deliver that research? Because those are two different things.
Marianne, if you can maybe answer that question, we might be able to come back to you.
I can also say something to that, Leslie.
Go ahead, Joe.
So in respects to the consumer advisory panels that we support at Monash Partners, we assume people are going to drop off. And so we found that the ideal number is somewhere between 8 to 12 consumer and community representatives in our group, knowing that after about 6 months, we're going to start to see drop off, and we plan for that. We also assume that people will just naturally have other things happen, or maybe it's just not something that's interesting for them. So you kind of just got to expect that's going to happen, but also just paying attention to what their needs are, and engaging them, appropriately. Because if they come in thinking it's one thing and it's actually something else, of course they're going to drop off. But that's in that consumer advisory panel environment. That's
really good advice, though, because it's actually a proactive move rather than a reactive one, which is great. I've got time for one last question before we move on. How much is CCI being mentioned? Ashley, I'm going to hand this one over to you. How much is CCI being mentioned in undergraduate or postgraduate degrees? What advice would you have? Hang on a second. What would you advise to be normalized, meaningful engagement and involvement earlier? I'm not quite sure what that means.
That's a great question. And I think that goes to show the complexity of consumer and community involvement, that it's a bit of a culture shift from as a student all the way up to when you're a practitioner. And so it depends on which area you're working in. So prior to this role, I was working as a lecturer, a senior lecturer at and was teaching in nutrition courses. And I had the privilege of teaching third year undergrad students how to do research and what research is. And that's where I honed in the importance of involving consumers from the very start of your projects, but all throughout, your work. And this then comes back down to, if you're teaching in the health degree and you're teaching patient-centered care, that goes hand in hand with consumer and community involvement. It's all about what the patient needs and focusing a little bit around what you do to get the patient to help the patient get to the outcome. And so it's the same concepts, just different setting in that sense.
That's true.
Absolutely really important to start talking about it from undergrad, particularly in health degrees and health subjects. And to normalize it, we'll just talk about it as you would patient-centered care. You're working with these people. It's nothing about us without us. You don't want to be deliberating or creating something for someone else that they didn't even want to. So it's all about.
Yep. And there's also some learning tools that are being offered now as well. Ashley, I'm thinking of a workshop that's coming up soon, which is actually on CCI and co-design for postgraduate students. So yeah, I'm going to wrap up here with our last slide. There was some other answers to questions, to our question that we asked originally. And we're going to be addressing some of those questions in our CCI webinar, our next one, which will be in October. And it'll be around things like how to support CCI and the whole process, what's really required for good co-design, what does good co-design look like? How do you evaluate the quality and effect of CCI, which is a great question, and looking at case studies. In fact, that upcoming workshop that we have, we'll be looking at case studies and making research accessible to communities, which is fantastic. So I would like to thank absolutely everybody, but just before I go, maybe one last sentence from each of our panel members on insights and comments on today. Jo.
I think that this is a really great brains trust. And so if you ever have any questions, then I think this is a great place to start with consumer and community involvement.
Right. Ashley.
I've just been thinking of the last question that popped out around how consumers listening in, and they found it interesting that no consumer was involved in this. And I just wanted to say that's a really great point. Thanks for picking it up and calling us out of it. I identify as a lived experience academic, so I do wear lots of different hats. So I can speak to that, but I appreciate it's not the same. And I think this is a really great emerging space, and we do have a lot to learn, and we are still learning.
Yes. Auntie Carrie, one last quick comment before we wrap it up.
Thank you. We say nothing about us without us, and I think that goes for all consumers everywhere.
I do too. And let's hope we can move at the speed of trust. I thank everybody for joining us today. I'm